Hi, my name is Hannah Holt, licensed practical nurse. I'm here to discuss the current nursing orientation of the Centers for Living and Rehabilitation and the revisions to the nursing orientation to facilitate safe patient care, nurse satisfaction, and reduction of cost to the facility. On the agenda, we have the current orientation at Centers for Living and Rehabilitation, with emphasis on the length of the time, the content taught, and the risk to the facility and residents with the current nursing orientation. Then we have the revision to the nursing orientation, which includes a longer orientation and a more thorough aspect of contents taught. I have a list of materials needed, the benefit to the facility, nursing satisfaction, and the budget. The current orientation for new nurses has a very shortened time, and in this time, there is not a lot of time to talk about risks to the residents, a full understanding of the policies and procedures in the facility, and not enough time to fully understand the role of the nurse. In regards to resident safety, there truly is not enough emphasis placed on how to prevent injury. And the risk for injury is heightened due to facility-acquired infections, medication errors, and mistreatment due to misunderstanding of policies and procedures. The current orientation also does not allow for a full understanding of the nursing role. This is in regards to safety in nursing practice, the documentation necessary for a full regard of the patient, in nursing skills such as diabetic insulin injections, patient transfers, and CPR. The length of the current orientation does not allow for a proper training to the policies and procedures of the facility which facilitate safe patient care. The risk to the facility is great. The cost of injury to residents is truly a huge concern when looking at the role of the nurse and the cost of facility-acquired infections. Medicaid will also not reimburse pressure ulcer formation, so if a pressure ulcer was formed in the facility, Medicaid will not reimburse. And medication errors, which is a huge risk to not only the patients but to the facility in regards to cost. Also, when nursing orientation does not provide nurses a full understanding of their role, there is a higher incidence of nursing turnover. Nursing turnover is highly costly to the facility as it brings in and also puts out a lot of nurses who will not stay very long, which increases the need for manpower, which increases the need for nursing trainees, which increases the facility's need for more skilled, trained individuals. My proposal for revisions to the nursing orientation include length. I feel as though a longer orientation for more time to focus on facility policies and procedures is necessary to deliver safe and effective care to our patients. The content also could be changed. I would like to focus more on safe patient care, the role of the new nurse, and specific training pertaining to the role of the nurse. Also, the continuity of orientation, where there would be one or two nurse trainers, frequent check-ins to determine the needs of the orientation for the individual, which can facilitate a much smoother transition. So the materials needed in order to make this plan a reality are staffing. We would need a team of nurses who would be willing to train to be specific orientation training nurses who would train the new nursing employees. Facilities. We would need a space within the facility for multi-level training with enough space for computers, for nurses, and for equipment that we would need. And in regards to equipment, we would need training equipment to understand the roles and new skills, for instance, diabetic injection pads to help train new nurses with injections. We would need CPR dummies, as well as computers for access to the policies and procedures and the ECS documentation. The benefit to the facility of lengthening the orientation period and revising the content include nursing satisfaction. As I spoke about before, nursing satisfaction is a huge reason why nurses will search for new jobs. Without proper training and feeling inadequate in your role, a lot of nurses will not be satisfied in their current role and be willing to change professions, change jobs, transfer from different facilities in order to find that satisfaction. And when nurses do leave, like I said earlier, there is a high nursing turnover. The reduction in safety risk to the residents, like I said before, truly understanding the policies and procedures to facilitate safe patient care, understanding nursing skills, like I said, such as transfers to reduce the risk of injury to the patients, the injections for diabetic insulin administration is highly important to reduce risk, and once again, the reduction in cost to the facility. And when I talk about cost to the facility, I am really capitalizing on the cost of injury that occurred within the facility that Medicaid and Medicare will not reimburse due to the fact that it happened within the facility. And once again, better nurses equal better care. So the length of the orientation being prolonged and the content being revised to be more resident focused and more task focused will truly make for better nurses to deliver better care. And then once again about nursing satisfaction, just a better understanding of our role as nurses equals less nursing turnover, which equals a higher continuity of care to the residents. It equals less turnover, which equals less cost to the facility. So the budget that I have set out for this is mainly focused on the equipment really needed to facilitate this transition. As you can see, the vendor costs and the hardware costs and the project team are definitely the most expensive aspects of this budget. Although if you look at the cost of injury pertaining to patients and the fact that Medicare and Medicaid will not reimburse, this is truly a larger initial cost, but over time it will be truly beneficial. So in conclusion, more orientation and a better content equals safer, more effective care in the cost-effective sense. And now I'm opening the floor to questions. Thank you for listening to my presentation, and I highly suggest you consider my revision to the current nursing orientation.